question. Please begin reading.
Okay.
Right. So if you have read and understood, considering it history taking station, kindly please begin.
Hello, I'm Dr. Ahmed, one of the surgical doctors here in the clinic. May I confirm your name and age, please?
Yes, miss. 54 years.
Hello, miss. Today I have been asked to ask you a few questions regarding your condition. Are you okay with this?
Sure.
Okay. At the first, could you tell me how can I help you today, miss?
Actually, I have experienced some pain with my back, which is agonizing to me, really.
Yes, I'm so sorry to hear this, miss.
Mhm.
Can you tell me, did it start suddenly or gradually?
It was gradual onset, yes.
Okay. Can you tell me since when it started?
Actually, it's the first time I have experienced this was 5 years ago. Yes,
Okay.
yes, it was my first time. I took some medication and relieved, but I feel the pain is increasing over the last 3 years.
Okay. Can you? I'm so sorry to hear this. Can you tell me, is it increasing or decreasing?
Actually, the pain was relieved after I have experienced this for the first time, but it is increasing over the last 3 years.
Okay. Can you tell me where exactly do you find the pain?
All over my back, I think, in the center of my back, I think, yes.
Yes, yes. I'm so sorry for you. Can you tell me, is the pain is moving anywhere else in your body or not?
I think I feel the same pain in my leg and
Okay.
down to my feet.
Okay. Okay. Can you tell me, if you can rate the pain from 1 to 10, which number can you give it?
6. I think 6,
Okay.
yes.
Can you tell me if there is anything make it better or make it worse, this pain?
Actually, I feel that the pain relieved by resting on
Yes.
my doing my work, it increased. Yes, I
Yes.
actually cannot
Yes.
afford my work without take painkillers.
Yes, I hope you'll find a solution for you, miss. Can you tell me if the pain is relieved with when you are walking up a hill or upstairs or walking rapidly?
Actually, I think yes, it is relieved when I'm going upstairs. It relieves.
Yes.
And the rest, and by the rest.
Yes, yes. Can you tell me if there is any stiffness in the early morning, in the if, for your, any stiffness in the back in the early morning?
No, I haven't experienced this.
Yes. Can you tell me if there is any increase in your body temperature, any cough, any some chest problems?
No, I don't have. So just the pain at my back.
Okay. Did you have any fractures in your body which occurs more easier than expected?
No, I haven't had any fractures.
Okay. Can you tell me if there is any change in your appetite or decrease in your body temperature recently? Sorry, a decrease
No,
in your body weight recently?
no, I think I eat well and my body weight hasn't decreased.
Okay, can you tell me if you have any numbness or any weakness at your leg?
Yes, I think the weakness and almost affect my leg and down to my feet. I feel that.
Okay, okay.
Mhm.
I'm so sorry for you. Can you tell me if there is anybody in your family has the same problem?
No one have experienced it.
Okay, can you tell me if do you have visited your GP recently?
Yes, the first time I had the attack, I visited my GP, who arranged it for a radiological investigation. I think it's called MRI for my
Yes.
back.
Yes.
He advised me for take some painkillers and doing physiotherapy. But as I mentioned, the pain increased over the last 3 years. No improvement
Okay.
of the condition.
Okay. Once you have been diagnosed with this pain, have you had any surgical procedures upon it?
No, I haven't.
So the doctor tells you that it is a normal, it is a weak pain and does not need any surgical interference.
Yes, yes. Just for medications, no surgical
Yes,
intervention.
Yes. Can you tell me what is your concerns about your condition?
Actually, I am concerned about not knowing the cause of my condition. This is concerning me.
Yes, I
Yes,
see. Can you tell me
Mhm.
what you're expecting from us to do for you?
Just to relieve the pain. I
Okay.
need it to relieve.
Can you tell me
Uh,
what do you think the cause of your symptoms?
I think increase my work, increasing this pain.
Okay.
Yes,
May I ask you some personal questions, please?
yes, sure.
What do you do for a living?
Actually, I'm a teacher, but I need to work an additional work to take care for
Yes.
my husband who is disabled.
Yes, yes, your husband is disabled. I'm so sorry for
Yes.
this. I'm so sorry for this. Can you tell me,
Mhm.
if you have any problems walking up the stairs?
No, the pain is relieved by walking upstairs. Actually,
Okay. Can you tell me, do you smoke or drink alcohol?
no,
Okay. Can you tell me if you have any problems passing your urine, if you have any problems, any constipation, any diarrhea, any vomiting,
no, I haven't experienced such any conditions of this.
any muscle pain, any joint pain, anywhere else?
Just the pain at my back and down to my feet and leg.
Yes. With whom do you live,
Okay.
Miss?
Can you please summarize your history now?
Okay, today I have taken a history from Miss, which presents to my clinic with a low back pain. But the pain started gradually 5 years ago, and then it relieved by medical treatment, and then it increased second time 3 years ago and become increasing. The pain, the patient seek medical advice, which was written for him some analgesics only. The patient has a social problem with her husband, and she is advised to work for her family, and also the patient had done MRI and had some degenerative changes. The patient has no the patient pain is increased with is relieved with is increased with doing activity and relieved by rest, and the patient has no any decrease in body temperature.
Okay,
And
so
has no
considering the history that you have taken, so what is your provisional and differential diagnosis?
my main differential diagnosis upon this history is a mechanical back pain. I also have to consider coda equina, ankylosing spondylitis, any infective causes such as TB, any metastatic causes, or osteoporosis.
All right, so how would you confirm your diagnosis? What investigations would you ask for?
Okay, I need to do full neurological examination for the patient, and also I have to do some investigations such as full blood picture to exclude infective causes which has some anemia, and the chronic causes which has some anemia, and inflammatory markers to exclude ankylosing spondylitis. I also have to consider X-ray and PET scan if osteoporosis suspected. I also have to consider quantiferon and quantiferon test and for exclusion of TB. And also, if coda equina is suspected, I might consider an urgent CT or MRI.
Okay, what treatment or management can you suggest for her?
I can suggest a conservative management with active exercise, but not severe exercise, and also I can consider some analgesics such as non-steroidals with care of with a gastric protection, and also I can go for some fomentations and refer a patient to a social worker for any help to minimize her work. And if suspected and if the patient is diagnosed with any one of the previous other differentials, I would treat as it will be diagnosed. As code equina, it will need an urgent interference with urgent decompression, and other causes need specific treatment.
What are the red flags that you'll consider or which will alarm you to think of cord compression or cord equina?
Yes, for the coda equina, there will be a new ejaculatory failure, and also a severe shooting pain towards the leg, and severe numbness, and severe weakness, and also there will be maybe paralysis in one of two limbs.
Yes, and there could be history of cancer, weight loss, fever. There could be history of trauma.
Yes.
And the age group, most importantly, it should be between less than 20 or greater than 50. So she comes in that age group, but does not present with those symptoms. Okay, good. Right. Okay,
Yes.
thank you.
Thank you.
Right.